All right. So we're live now. What I'm going to do is I'm going to look at our participants and I'll give us a few minutes. We'll wait a minute or so now that it's live and people can start logging in. We'll give it a minute. Perfect. Good evening, attendees. We're going to wait about 2 minutes to allow more attendees to join us, and then we will kick off the panel.
Brian, I'm getting a message saying that my wife is having issues with the link.
That's strange. People are able to get in. I'm seeing people come on in.
Should she use the QR code? Will that help?
The QR code will take her directly in.
Okay.
Thank you, all the attendees who are joining us. We're going to wait one more minute to allow a few others to join the call, and then we will start shortly.
Recording in progress.
All right, we will get started. Good evening, everyone, and welcome to Alpha Phi Alpha, Alpha Alpha Lambda Chapters Health and Wellness Committee sponsored panel, Kids and COVID, Facts About the Vax. My name is Brian Agnew, and I will be serving as the moderator for tonight's panel. With us, we have three esteemed panelists who are quite knowledgeable about this topic and will answer any questions that you might have. Feel free to put those into the Q&A or the chat area, and we'll bring them up throughout tonight's discussion. First, I'd like to introduce Maya Lordo. Maya Lordo is the Essex County Health Officer. Next, I'd like to introduce Dr. Henry Thompson, CEO of Community Health Center of Richmond, a federally qualified health center on Staten Island. And I'd also like to introduce our third panelist, Dr. Sean Flynn, pediatrician and owner of Step by Step Pediatrics in Bloomfield, New Jersey. So with that introduction, why don't I ask each of the panelists to take 1 minute to introduce themselves and tell us how the pandemic has impacted a child that you know. Maya, why don't we start with you?
Good evening, everyone. Thank you so much for having me on. So just a little background about me. I have been with the county about 3 years now. I started with the county 6 months before COVID. Originally, I was the assistant health officer in Bloomfield, Dr. Flynn, and I worked with 8 other municipalities. My background is in public health. My master's is in health administration, and I'm a state licensed health officer. I've been, my first date that's important kind of with COVID is going to be March 26th of 2020. That was the first testing site that the county had started. 9 months exactly later, we started doing just on December 26th, the day after Christmas, we started doing our vaccine program. The county originally started out with 5 full mega sites. And now we are back to 3 full mega sites that are open in West Orange, Newark, and also in Livingston. And I think I'm going to say that we started vaccinating kids between the ages of 5 to 11 on November 3rd. With that, I will have to say can't really say I'm impacted by just one child, because as of right now, since November 3rd, we've done about 8,000 5 to 11 vaccinations. So I think I've been impacted by about 8,000 kids ages 5 to 11, hearing them and coming into our facilities. I think I've been more impacted by their parents. How many of them are so excited to get their kids back to sports, back to seeing grandma and grandpa, back to seeing their friends, and back to their own life. I remember specifically on the first day that we started vaccinating, I remember hearing a mother say, "We're finally going to do this. You're going to be able to go see grandma." And I think that really, truthfully, is one of the ways that this all has impacted me. So I just want to say thank you again. And I just want to say thanks to our county executive, because without his leadership, this would never be possible. And thank you to County Executive Joe DiVincenzo.
Maya, thank you. Next up, Dr. Flynn, give us a minute about yourself and please share how the pandemic has impacted someone that you know that's a child.
Good evening, everybody. Like Brian said, my name is Dr. Sean Flynn. So just a little bit about me. I established Step-by-Step Pediatrics 8 years ago, but I've been in private practice for 12, almost 13 years. I've been in the Newark, Bloomfield area pretty much since I started residency. So that was around 2005. So I've been able to not only interact, but just help with, a numerous number of children, over the last, several years. But in regards to how COVID has affected a child that I know, I mean, I see children every day. So it affects a lot of children that I know. I've had, from the most simple, COVID infections, a cough and cold, to a child who was hospitalized because of multi-system inflammatory disorder. So, and in that 5 to 11-year-old age range. So it's important, and I think that this talk is really important because, this was prior to a vaccination being available for most people, not just, for children, but also for adults. And ideally, something that potentially could have been prevented, provided there was a vaccine available at the time. I just think that we're in a really critical time where we need to make sure that our children are going to be safe and protected. And I'm looking forward to, just spreading a little bit more information in regards to that to help as many people as we can.
Thank you, Dr. Flynn. Dr. Thompson, will you please give us a little bit about yourself and the impact that the pandemic has had on children that you know?
So good evening to all the attendees, and good evening also to my fellow panelists. And thank you, Dr. Agnew, for sponsoring or hosting this important talk. My name is Henry Thompson. I've served as the Chief Executive Officer for the Community Health Center of Richmond, located in Staten Island, for over 12 years. I currently am an Essex County resident, and so that explains my relevance to this panel. I just want to qualify that I'm not a direct practitioner, but I am an administrator. How the COVID-19 has impacted a child in my life, I will speak towards my 5-year-old son. And so we made the decision as a family that he was starting kindergarten this year, but there was so much uncertainty with the school. And while he was in pre-K 4, the stop and go with in-person learning as opposed to online, it was very disruptive. And we felt that he wasn't really getting the attention that was needed. We were fortunate that my wife, she is an educator. And so she was able to put that educator hat back on, and we decided to get him in an online academy, which has a very, very thorough curriculum. And so it's worked out pretty well with that regard. As far as my center is concerned, we have not rolled out the COVID-19 vaccines for adolescents or 5 and older as of yet. We expect to get our shipment by next week, but we have put in place the non-specific patient standing orders in order to administer those vaccines through our vaccinators. So we have a wait list of parents who are eager to get the vaccine as well. And so we're looking forward to rolling that out within the coming weeks.
So the first question that I will throw out, thank you to each of you for the introduction, is going to be around the differences that we're seeing between adults and children with the vaccine. So with 8,000 children vaccinated under your watch, and Dr. Flynn, with the patients that you see every day, maybe the two of you can take that question about the biggest differences we're seeing between COVID in adults and COVID in children and adolescents.
I'm going to speak to what the vaccination process is and just kind of educate as far as the vaccines are concerned, and I'll leave it to Dr. Flynn to go to that clinical perspective. So let's all start between the differences between the 5 to 11 vaccine versus the adult vaccine. So right now, the only EUA approved 5 to 11 vaccine is the Pfizer vaccine. It differs in the way from the adult Pfizer vaccine is, number one, it is a lower dose. The full dose for the adult vaccine is 0.3, and the child vaccine is 0.01. The formulation for the vaccine is also different. The formulation is less concentrated for children. The same, they do have some similarities. They are the same product, they're just a different dilution. They also are both Pfizer products. They are also a 2-dose series given 21 days apart. I think the biggest difference that we are seeing with adults and children are obviously children are a little bit more apprehensive to go ahead and get that shot, but then again, so are some adults. We have not seen any very serious reactions at all with children. When you come to our sites, what we're providing them with, our booths are all decorated, they're child-centered. We have a completely separate pediatric area. So the kids are definitely all in different booths. They have separate pediatric nurses that tend to them. They also have a completely separate monitoring area. That monitoring area is equipped with a big TV screen. They're given lollipops when they're sitting there. So it's kind of also about the environment that's provided for them. I think the other thing that we are kind of differentiating as far as our sites are concerned is that our pediatric doses right now as of current are by appointment only. And the reason for that is, and I think maybe Dr. Thompson can relate, there was a little bit of a wonky situation with inventory as far as the rollout of the vaccines. So we want to make sure that anyone who's coming to our sites is indeed has an appointment and definitely has a vaccine. So we'll see if that's going to change, if that's going to change to a walk-in status, but as of current, we are offering them by appointment only.
Perfect. Thank you, Maya. And we're going to get into a little bit more specifics about how people can access that a little later. Dr. Flynn, clinically, what are you seeing in patients that are coming to you? What are we seeing as the difference between adults and peds?
Well, I think that number one is, their general consensus is yes. When you're comparing children to adults, it becomes a question of severity, right? And so the obviously in adults, you've seen the gambit in regards to severity. Obviously, people have been hospitalized in ICUs, lost their lives, things of that nature, due to a coronavirus infection. I think the big difference, and I know I've seen that trend in my office, if you compare the beginning of the pandemic to now, is that the numbers have just increased overall in regards to the pediatric population and in regards to the number of cases that you're seeing, in general, that's including whether or not, patients are being hospitalized or not. I think that this particular population, the 5 to 11-year-old population, maybe about just under 2 million cases in the 5 to 11-year-old population that we've seen. That's again inclusive of those who've been hospitalized, those who've been in ICUs, those who've had symptomatic disease but not necessarily requiring hospitalization. The overwhelming majority of children, I think, who have been infected typically have more cold-like symptoms, cough, congestion, some fever, body aches, things of that nature. And so, thus far have been able to survive that particular storm. I think that the one thing that we always have to keep in mind, though, is that you never know who's going to be that one, who may have more severe disease, who may end up in the hospital. Which is, talks to the reason why it's so important to vaccinate, the younger population, because you never know. And you don't want to be that one person who's like, oh, that'll never happen to my child, and then it happens to your child. Especially when it's something that could be prevented. We're seeing that it's occurring more and more, and I think that until we get a better handle of the pandemic as a whole, which is really including vaccinating children, then we're not really going to be able to move past this. I was actually listening to a lecture by that included, or I shouldn't say lecture, it was an interview with Dr. Paul Offit, who's a pioneer in pediatric infectious disease, and his statement was that, which some people may not necessarily want to hear, is that, we probably still have at least 2 to maybe 3 more years of dealing with this pandemic, and the only way to really be able to move past that is to make sure that we're vaccinating everybody. A few months back, we got the authorization to vaccinate children from 12 to 15 years old, which was great. But as far as the current numbers, maybe about 45% of the 12 to 15-year-olds in this country have been vaccinated, which is obviously not enough. And the expectation, unfortunately, is that there may be less in the 5 to 11-year-old population. And so, it's really, really important for, obviously, like professionals like myself, Dr. Thompson, Maya, to really, really continue to encourage parents to get this vaccination done if we're going to, really be able to move past this point.
I'm going to ask the question. We talk about vaccinations as if that's important, and you quoted some numbers. 45% of the population, 15 to 18, I'm assuming, is that group.
12 to 15.
12 to 15, excuse me.
Mm-hmm.
So why is vaccination, take COVID out of this, why is vaccinating a population important? And I put that out to the entire panel.
I'll just to start, the goal of vaccination, regardless of the disease that you're talking about, is to prevent spread. That is the number one goal of vaccination, to prevent spread. And so you're regardless of the disease, whether you're talking about tetanus or measles, mumps, rubella, you're talking about the flu, chicken pox, meningitis, the goal is to prevent the spread. All of these diseases are contagious and can be passed from one person to the next, depending on the situation. And so, the goal is to help prevent the spread of, one particular disease to everybody. And so, you're because of the fact that you're talking about diseases that potentially can be fatal, And, while, a lot of people may say, okay, yeah, you can be exposed, your immune system grows, it strengthens with exposure to various illnesses, which is not untrue, it is. But for, whoever the person may be, you may not really get that opportunity. So rather than expose yourself and, and run the risk of not being able to recover from that vaccination, from that disease, excuse me, you get a vaccination that does not cause you to get sick, but will allow your body to create the necessary immunity that you'll need so that if you do indeed get exposed, then you won't get sick.
I agree, Dr. Flynn. I think what you said is number one is we want to prevent spread. And number two, we want to decrease the severity of the disease itself. One of the things that we've seen is so, I don't want to say different because it's not. One of the things that's shocking in COVID is that those individuals that we may not think would get the severe form of disease are the ones that ended up getting it. So we've all heard the 32-year-old healthy marathon runner that ended up in the ICU on a ventilator. We've all heard of the individual who refused to get vaccinated as a nurse and now unfortunately, has, been able to give birth to a child but has passed away due to COVID because of their unvaccinated status. I think one of the things that we need to understand is that right now with COVID, what we don't understand is who's going to be more susceptible to getting that severe form of disease. The one thing that we do know, if you do get vaccinated, the severity of the disease greatly goes down and your chances of ending up in the hospital or severely worse death does decrease with vaccination.
Now, how do we know that about the population of children ages 5 to 11?
I think, go ahead, sorry, Dr. Thompson.
No, I just wanted to add and touch on a point that Maya raised as well as Dr. Flynn about the logistical component of making sure the audience or parents who are considering getting their children vaccinated is that the way the vaccinators are, the vaccine is distributed, it's in certain quantity. And in the very beginning of the pandemic, when the vaccine became available, everything was by appointment only. And if you recall that once that vial was punctured, you had to use so many doses within a certain amount of time, unless the vaccine would get spoiled and all those things. So I think one of the things that is key is making sure that if your child or the child in question has any type of severe allergic reactions to any type of vaccines, that the parent or guardian is consulting with the respective pediatricians on what could be the potential side effects and what could be what should be expected so that nothing becomes a surprise. And I think that, as both Maya and Dr. Flynn pointed out, that the unpredictability of COVID-19, when we look back at the beginning, even at our center, our patient zero was a 21-year-old male. And I tell everyone about that story because this is an individual, he came to us as a new patient, so he was being compliant. And one of the questions that the provider was screening them for is, hey, did you take any over-the-counter medicine prior to coming to your appointment? And he responded, yes. He took a Dayquil before coming in and he had 103 fever. And the provider said, what are you doing here? And he said, hey, I went to the emergency room. Here are my discharge papers. They said I was fine. So what we found was that the emergency room, hospital emergency room, they did all of the screening. They asked all the questions, but they did not administer the test because this was an individual that was not considered priority. And so I think about it that here it is, someone is 21 years old. They could have went to the mall. They could have hopped the jet and went on spring break. And that immediately would have caused, more community spread. You know, so when we look at the unpredictability of it, and I remember a talk by a doctor from Johns Hopkins where they eventually said, hey, you know, this will be around for 3 to 4 years or however much time, and eventually it'll be like the flu, that some people take the flu vaccine, some others do not. And so we're getting to that point, and so we're starting to see that with even our current patient population.
So one of the things that I was going to start to ask us a little earlier, that many parents are concerned about in the vulnerable population of children that we're here to talk about tonight, is the vaccine safe, right? When someone comes to you and says, hey, I'm really considering vaccinating my child, but I'm just scared, what's your response to that parent?
I think I'm going to start from a historical perspective. We had polio, we had measles, we had mumps. We've been pretty much mandating to an extent and having a course of vaccinations throughout history and the history of disease. One of the things that we all need to understand is that, especially this particular vaccine that we have right now for the 5 to 11 population, is an mRNA vaccine. The mRNA vaccines have been around for approximately 10 years. The mRNA vaccine is not a live virus. It is actually it's the best way that I've learned to explain it is that it's a mugshot of the actual virus that gets shown to your immune system. And it says, here you go, this is what we look like, let's keep an eye out. And it's almost like a tap onto your immune system saying, listen, if you see this again, you know how to react to it. So that's really where we're at. And again, these types of vaccines are not new. They've been around for quite a while. So I think for those individuals who are nervous about what the information out there is, I think the biggest thing we need to understand is the information that we get needs to be from a credible source. And I would like to point people into the realm of the CDC, World Health Organization, things that are pretty much kind of true and tested and have a scientific background. I'm going to say this: TikTok, Instagram, not exactly your best bet for vaccine information, which unfortunately is where some of our misinformation is coming from. So I think as health professionals and as people who are integrated into our communities, I think we need to start steering people into the correct resources for information about these vaccines.
I think that that's a really good way of explaining how the vaccine works. A mugshot for your immune system to look at and to know. So it's just like those old wanted posters in the post office of criminals. Basically, that's what it is. You know, so your body knows what to look for, and once it sees it, it destroys it before it can cause any disease in your body. You know, and so, you know, obviously you may hear a lot of there's a lot of different opinions about, you know, how the vaccine works or whether or not it's safe or not, you know, and I think that you know, explaining how it works and what exactly it does has been the best way for me to relay to people how, you know, what they should be thinking about the vaccine itself. Because it is a messenger RNA vaccine, it does not do anything to your DNA. You're not going to become a mutant or a zombie or anything like that. This is not the beginning of the apocalypse for those who may think so. You know, but, you know, again, like Maya was saying, this type of technology is not new. You know, this vaccine is the only new piece of, you know, this technology. So, you know, for those who talk about, you know, why it's so quick to you know, how this come out so quickly and has it been tested enough, you know, what's been going on in regards to testing of this, you know, particular vaccine is not any different from 5 years old to 25 and 30-year-olds. The testing is the same. The only difference between this vaccine, particularly for the 5 to 11-year-old population, as opposed to older children, is the dosing. And that's it. You know, and the way that that dose was figured out was done even before it was tested on children. You know, you're looking at, you know, they tried different doses at different levels to see what is going to provide the largest level of immune response with the smallest amount of actual vaccine given. And that's how they ended up with this 10 microgram, which is a third of the amount that's given to older children and adults. You know, the biggest thing that you know, like your question about, you know, whether or not it's safe or not, you know, there were about 2,400 children that were in that trial for this particular age group. And in that, you know, I think about 1,600 were given the vaccine and 800 were given a placebo. There were more actual cases of COVID in the placebo group as opposed to the children who actually got the vaccine. Nobody had any severe, you know, symptoms at all. I know one of the big questions that some parents have is in regard to the potential for myocarditis. That's the big thing that you know, was being seen in the older population, particularly once the vaccine came out for the 12 to 15-year-old population. What the studies have shown is that, you know, that the myocarditis or the cases of myocarditis that were being seen were actually more so in that 16 to 25-year-old group. But the interesting part of that is that it's not myocarditis in the way that, you know, you would typically expect to see myocarditis. For example, for someone who actually had a coronavirus infection, this particular type of myocarditis is very short, it's very self-limited. It didn't require any extra medication or anything like that. It happens and then it goes away. They didn't see that in any children that were in this clinical trial in the 5 to 11-year-olds. Now, you know, you can ask the question of whether or not, you know, there were enough children in this clinical trial, but then you also have to ask the question, well, you know, how many people are willing to, you know, enter their children into a clinical trial? And so you have to do what you can with what you have and just extrapolate from there. You know, the best conclusions that you can come up with, you know, based off of the data is to say, obviously it's effective. It's 91% effective against symptomatic illness. You know, and so you're seeing the same type of effect in both young children as you were seeing in adults. So the expectation is that, you know, the results will be the same. You'll see a decrease in the potential for infection. You'll see a decrease in the potential for severe symptoms if you were to be infected, and a decrease in the potential hospitalization.
So there was a question that was placed in the chat, and I want to clarify something. You know, we know that messenger RNA was developed in the 1960s or discovered in 1960s, and then ultimately delivering them to cells started to be developed in the 70s. Why did it take so long for mRNA to become such a commonplace term in 2020, right? What was the time horizon or gap, if you will, why mRNA wasn't more prevalent in our vaccinations from 1960 when it was founded until 2020 when we started delivering COVID vaccinations in this way?
I think I have to do my research on that exactly, but I think I do see that. I know that the vaccine development was done for Ebola. I've also heard that too. I can definitely go ahead and do some research and send it over to, I believe it was, who was that who asked? Carl? No, so.
Cal McNeil. So
Okay,
I can
yeah,
convey that
I
message
will
over.
definitely go ahead and do my due diligence on research on that for Cal.
Perfect. And to all of those watching, please feel free, just as Mr. McNeil provided a question, put your questions in the chat. We'll be happy to bring them up as we go on throughout the evening. So we've already talked about how the vaccine works. We've talked about the side effects. So then the question becomes, should my child be vaccinated for COVID-19 and ultimately why?
I think that question, you know, is a question that you know, also, you know, parents ask, you know, for themselves. I mean, honestly, it happened just today, you know, with a patient and a parent of mine. You know, and what we have to understand is, you know, and I think Maya alluded to this a little bit earlier in regards to other diseases, you know, that we have seen in the past. in order for us to truly be able to move past the coronavirus pandemic, everybody needs to be vaccinated, or at least an overwhelming majority of people need to be vaccinated. There are still millions of children, that have not been vaccinated that we need to, look into. If we are going to be able to truly feel comfortable, not only sending children to school, but just gathering with family. It's Thanksgiving will be here in a week or two. Christmas is coming. Birthday parties, Easter, all these events that we want to be able to spend time with family, or even just to spend time with friends. This is the way to be able to do that. At least for your individual child, at least you will know that your child will be protected. You cannot guarantee what everybody else is doing, but in order to prevent, the potential of infection for your child, this is the way to do it. Because we cannot necessarily count on your neighbor to make sure that they have been vaccinated, or your friend, and then also thinking about, okay, when your children go to school, especially in the 5 to 11-year-old population, we want them to keep their masks on to help prevent spread of anything, not just coronavirus, but coughs and colds or what have you. But more often than not, the majority may not do that. And so if we want to feel comfortable sending our children to school and making sure that they continue to get the education that they need and to be able to socialize with their friends, this is the way to do it. We do not yet have medication that will, ensure that a child that becomes infected, won't end up in the hospital, and until that, becomes a thing, then, this is the way to move forward. I don't know that there's another way to truly feel comfortable with our children, or the feeling that our children are protected, without doing this. You can try, I know there are, lots of people who are, very supportive of, natural immunity and vitamins and minerals to make sure that you're boosting your immune system, which I think everybody should be doing anyway. But again, that is not necessarily a way that we can reproduce for everybody. Children don't like to eat. They like to do what they want to do when they want to do it. And so just, to say that, we can do, vitamin C, vitamin D, and every kid is going to take it, and zinc, and every kid is going to take it, and make sure the immune system is going to be, improved or stronger, is not going to necessarily work for everybody. So because you cannot guarantee, that every child is going to be able to do that, this is the way to prevent that spread. So you want to make sure that your one child is not exposed, and then like Dr. Thompson was talking about, they may not be symptomatic, but they may have an infection, and then spread that to the next person and the next person. And because your child is not symptomatic, you may not even get them tested to see and be able to say, okay, oh, my child was in school for this many days, and they've now spread this to like 15 to 20 other children, who've then spread it to another 15 to 20 other children. So this is the best way to move forward to make sure that we're, going to decrease the spread and feel at least more comfortable being able to send our children to school and have them be around friends and family as well.
I think the other thing is just to also say is, I just remember that mother saying we get to go see grandma. I think with the vaccines, the amount of viral load that we're seeing is a lot lower in those who are vaccinated. I think that's also an important comment to say with them going to see at-risk family members, or during the holidays, especially. I think that's also important. I remember one was saying that there's they haven't seen their grandmother for X amount of years at this point, because they're more afraid that they're going to give it to the grandparents than the grandparents themselves are going to give it to them.
And I would just add that, Dr. Flynn touched on a great point, is that especially when it comes to our children, we don't know what the other children, what they're at risk of, what they've been exposed to. and so forth. You know, I'll go back to my own experience. My son was in pre-K 4, and there were letters coming out from the school telling parents that, hey, if your child has been on some type of medication, make sure they complete their series of medication before you send them back to school, and all of these different things. So February 13th, 2020, which is a Thursday, I remember picking up my son from school, and there was a Valentine's Day party that day. 100 kids were going to be there. And he said he didn't want to go. He wasn't feeling well. So we brought him home, and he immediately went to sleep, and he slept all through the weekend. He had a fever. We said, look, if the fever does not break by Monday, we'll bring him to his doctor. And so even at that point, you know, my wife is convinced that, hey, she was exposed to coronavirus and everything before the first cases even hit New Jersey. But we were seeing all these things, and we know that we were not going to restaurants, we were not going to the parks, we were doing social distancing, we were wearing masks, we were sanitizing everything, but you just don't know what other families are doing. And I don't think it was deliberate, but it's just the severity of how the projection of the disease, it was just unknown. And so I think that's the biggest thing, that yes, you can try and tell kids to, you know, how are you going to tell kids to socially distance? You know, it really has to be enforced by adults, but you know, kids are kids. They socialize. That's how, that's part of the learning, and that's part of, you know, generating their creativity. So how can you tell them not to, you know, socially distance? So from my standpoint, I think is, you know, making sure that each individual family is doing the best possible to keep, you know, themselves safe and their children safe. So that's what we plan to do.
So my next question, let me see who's did some feedback. My next question is going to be about the differentiation between the vaccine for children 5 to 11 and those in adults. Someone mentioned that it was, I believe it was you, Dr. Flynn, that the vaccine for children 5 to 11 is 10 milligrams. Is it 30 milligrams for adults?
It's micrograms. It's
micrograms.
It's yeah. So it's 10 micrograms versus, you know, 30 micrograms, which is, you know, the 0.3 versus 0.1 milligrams. And so that's the difference. So basically the dose for the 5 to 11 group is a third of the dose that an adult would get.
And so the follow-up question to that would be, is there any other difference than the size of the dose?
I think that, you know, because, and I think Maya may have alluded to this a little bit earlier in regards to how it has to be processed, you know, to make sure that it will continue to be stable. And so there are some minor differences in, you know, in the pediatric dose as opposed to the adult dose, but that doesn't change anything in regards to the effectiveness of the vaccination itself. It's more so about how it needs to be processed and transported to make sure that it will remain viable. You know, and that's the biggest difference. Other than that, it's pretty much the same.
All right, and I think that was Maya who said that. My apologies. So since we give that dose at the age of 12, if I have a child that's 11 turning 12, is your recommendation for them to get the vaccine, the 10 microgram dose at 11, and then they turn 12 and they get the full vax? Or, you know, can you explain someone who has a child that's 11, that's on that cusp, what their decision should be? Because I'm sure that's going to impact some of our families.
So we get that at our vaccination sites pretty much daily. So when you're 11 years old, you qualify for that pediatric 0.01 dose. When you are, if in 21 days you turn 12, you will qualify for the adult Pfizer 12 to 17 full 0.03 dose. So it depends on what age you are at the time of your dosage, the time of your vaccination. So if you're 11 on your first dose, you get the 11-year-old dose. If you're 12 on your second, you get the full 0.03 microgram dose.
Perfect. Makes sense to me.
And just to kind of piggyback off of that question, because I know it's another question that I've gotten before. Some parents have asked in regards to the dosing, and say, your child is a bigger kid. They weigh more than the average 5 to 11-year-old might weigh, depending on how old they are. Does that change anything in regards? So if you have a 9-year-old or an 8-year-old who weighs as much as a 12 or a 13-year-old, does that change the dose? And the answer is no, because the dosing is not so much based on weight, it's based on the maturity of your immune system. And so, regardless of how much your child weighs, it's only about the age and what the immune system, or how strong their immune system would be at that particular age. And that's how the testing was done. And that's how the dose was, that particular dose was reached during the clinical trials. So regardless of how big or small your child might be, if your child was premature and they're just a really small, 6-year-old, as opposed to a really big 9-year-old, the dose is the same regardless.
There have been two big nuggets that I've taken away in listening to this, to your responses to questions. Maya, the mugshot example for mRNA, and Dr. Flynn, when you just said that the dosage is not based on weight, but based on maturity of the immune system. I think that really clarifies a lot, because we start to think about things from our own logical, non-clinical perspective, right? I'm thinking, well, if I'm 50 pounds and I'm 11 and I'm 70 pounds and I'm 12, does that change things? But the idea of the the immune system makes a lot of sense. So thank you for providing that clarity. Next question up is, after receiving vaccines, will children still need to take precautions to prevent viral spread at school or at other gathering locations?
Yes. Simple answer. Yes. This doesn't change the fact that coronavirus is still here. There is still, you still have to deal with the effects of the pandemic in general. So, as much as, we want the vaccination to work, nothing is 100%. And so we still have to take those precautions to say, hey, you know what? It's still out there. You don't know, like I said before, you don't know what the other kids in your child's class have done. You don't know what your other family members have done. And so in order to make sure, or to try to prevent the potential for exposure, yes, you should still be wearing masks. You should still, be concerned about, distancing yourself as much as possible, still sanitizing your hands, using hand sanitizer, washing with soap, whatever you need to do in order to keep, yourself, clean and reduce the potential for exposure.
I think one of the other things that Corona kind of taught us is what public health and doctors have been preaching for a very long time, and that is hand hygiene and communicable disease spread. I think one of the things that we've been in benefit of, that the flu season this year and has been quite low, right? Makes sense. We're all washing our hands. We're keeping our social distance. We are wearing masks. And I think until we have this as what we would call an endemic situation and a little bit more under control, I think continuing the same practices that we've been kind of saying as public health professionals pre-COVID still needs to continue and be more vigilant than we normally would be.
Makes perfect sense. So next, I'm going to ask, let me bring us back in the gallery. Someone's child, unfortunately, had contracted COVID. Should they be getting vaccinated? Do they need to worry about vaccinations? They heard on the news that something about antibodies in the child keeps them safe. What are your thoughts on that? Dr. Flynn, you're still muted.
Oh, sorry. So the answer to that question is yes. Again, natural immunity is not enough. So, and again, I had this question just today, actually, with a parent. So, in this scenario, the mom was exposed prior, the son was not exposed. And they did the testing, he never tested positive, anything like that. The thing about it is this, this particular parent was exposed early on in the pandemic. When we started the pandemic, there was one strain, right? So whatever antibodies she may have had after that particular infection are for that one strain. We now have multiple. And so whatever antibody or immunity that that is created after an actual infection is limited. The studies have shown that the antibody level that you're produced, number one, is only enough to help reduce the potential for infection for maybe about 90 days after infection. And after that, it's going to drop significantly. And even with it, it's still not necessarily enough to prevent, to truly 100% prevent another infection. But what the vaccination will do after even you've been infected will greatly boost your immunity. And now you're talking about it will provide broader immunity against the multiple strains that we're already dealing with right now. So, not only is it getting an infection and getting immunity from that infection is not enough, and it will not be enough. And it's already self-limited anyway. So, the potential for infection after the fact will always be there.
I'd like to throw this out to others about their thoughts around whether a child who's had COVID should go out and get vaccinated.
I think I'm just going to piggyback off of the antibody testing that we currently have. We don't have exact titers either, right? So we don't have a test that's going to give you exact titers and what your antibody resistance really is at the time. So some of us have went and got for example, your Hep A titers. We've done that. So we don't have that ability right now, COVID. Please correct me if I'm wrong. But if there's new technology, which could have come out yesterday, we don't have that right now. So I think, and also it depends on the individual too, how long you retain those antibodies, because with what we do here at the county, one of my responsibilities is our corrections facility. So what we had to do in the beginning of COVID, in order for us to be able to, because there was a very limited amount of testing and testing inventory that we had to start using antibody testing to start cohorting our inmates. We were the first probably in the country to start doing that. What we started to find was that the varying levels of antibodies and time was also something that we found to be very varying as far as how long some people retain antibodies and how long other people didn't retain them. So I think that's another misconception when it comes to antibodies.
There is a very pertinent question in the chat related to the communities that we serve. And the question is that there is a lot of apprehension in minority communities for adults. And now we see that extending to the children getting vaccinations for fear that these communities would be considered lab rats, in quotes. Are children and adults at greater risk contracting COVID in urban centers, predominantly minority communities, because there seems to be a great focus and concentration in those populations?
Well, I think the biggest thing that we saw as far as the spread of the disease, especially if you have families that, the proximity of how many people are within a particular household, that's going to put them at greater risk. I think the larger question about the apprehension for children, and that extends to adults, I think this is even a more greater societal issue that, hey, people are skeptical depending on who's bringing the message, right? So, I can remember growing up where, there was a fight about seatbelts. and whether they're effective and whether they will save lives and all of those things. And so I think that it's continuous education, and it sounds, so routine that being able to talk out those fears, I think in the United States, prevention has not been the priority of health policy development. It's always been more of a reactive. And so even if you look at the healthcare spending in the US, prevention or primary care is only less than 5%. And that's across the country. If you look at other countries, if you spend 10 to 15% of healthcare spending on prevention, it will be more of a proactive type of approach to healthcare. And I'm sure Dr. Flynn could even add, and Maya could also add, that even when you talk about training, right? As people are being trained in medicine or epidemiology, prevention is usually, not at the forefront. And so when you get into the practice, it's okay, let me just fix your problem now. And I just think that, health is not number one priority. When you're thinking about housing, when you're thinking about job, everybody doesn't get sick days to go to the doctor and all those things. So what happens? People wait, and that just creates more of a problem and a challenge if there's some disease onset. So I think it's more of a discussion now. I think because of technology, we're able to somewhat address these things in a more real-time basis and have these communications. But I think having forums like this and others, will help dispel that. And then the last thing I will add is that for all the conspiracy theorists and all of the misinformation that's out there, you almost need double or 3 times the positive information to combat those things. Because even very early on, as this thing was ravaging, there were tons. Even we saw it even among our own staff. Even within our own families, that there was all this apprehension, and even the professionals who were in the industries, people were looking at me with skepticism, like, why am I pushing these things and why are we doing this? And from my standpoint, we have a community responsibility and an obligation to serve everyone that came through our doors. So I know it's a long-winded answer, but I just think that at the end of the day, it's so multi-layered.
I think go right ahead, Doctor.
No, you go.
So I do have a hard stop. So I just wanted to end this. So one of the major changes in my perspective came when we first opened up our vaccination sites. And as most of you remember, there was a rolling eligibility for vaccines. And I remember our first sites that were opened. I remember seeing doctors and nurses running to our sites to get vaccinated. And I looked at them, and I remember sitting next to one of our sheriff's officers, and I remember him saying to me, he's saying, there's got to be something to this, because these people are seeing this firsthand and they're running this fast to come and get this vaccine. There's something to this, because they were there on the front lines of this and they were coming to get it. I think one of the things that Henry, you mentioned is we need the right information to come to everyone. I think we need to agree as a community what is the information, where we're going to get it from. And I think who we're getting it from is also 10 times more important. I think your leaders in your religious communities, anyone who's in kind of your gatekeepers within your communities are the ones that should be giving out this information, those that we trust. And I think for me as a public health professional and being, my first love being public health, prevention is key. And the only way that we're going to be able to start preventative medicine here in the United States is having the correct information being disseminated in the most easy, accessible way to everyone. And I think here as public health professionals, as people in the community who are influencers, I think that's where we need to come together and create platforms such as this webinar to be able to disseminate correct and proper information regarding disease, prevention, and promotion. What I'm going to do last is I'm going to put into the chat where you can go ahead and schedule your vaccine. So I just want to say we're currently offering 12 different types of vaccines at our sites. We're doing first dose Moderna and second dose Moderna boosters and additional doses for those who are immunocompromised. The same 4 go for Pfizer, also the J&J, and then the J&J boosters, and of course the pediatric doses. So you can go ahead.
Maya, you just muted yourself.
It's like having your flashlight on your phone. And go ahead and make your appointment. We have appointments available, and now I believe sooner than later, there will be an announcement for eligibility expansion as far as boosters are concerned for everyone who's 18 and over. With the holidays coming, I think it's definitely something that everyone here in the community can go ahead and take advantage of. So I just want to say thank you to my fellow panelists. Thank you so much, Brian. It's a pleasure to meet you all. I wish you all a safe and happy holiday season, and see you in 2021.
Thank you, Maya. We're going to have one last question to the rest of the panelists, which is the question that Maya started to get on, which is, let's say from this webinar, I've decided to get my child vaccinated. How do I go about scheduling a COVID-19 vaccine? We saw that in the chat, it was put www.essexcovid.org. But also, Dr. Thompson and Dr. Flynn, can you share how patients or those that you see might be able to access vaccinations in the communities that you serve?
I think that, Maya obviously, has posted, what Essex County is doing. I mean, I've personally seen, the facility in West Orange because my kids were there just a few days ago, getting their first doses of the COVID vaccine. So, it's for the 5 to 11-year-old population, it's been set up beautifully. You're seeing, other children. Obviously, it's not a cold and dark environment. It's very bright. It's very inviting. And then you get lollipops and coloring books, and you make it, a great thing. And it's a simple process to get done. Personally, in my office, we'll be offering that the COVID vaccine in the very, very near future. And so, you have that option as well. But I mean, I believe that, not just in, at the Essex County sites, I believe that the vaccine is also going to be able at, the local pharmacies as well. So your CVS or your Walgreens or Rite Aid or what have you. I think that, in the end, it shouldn't really matter where you go to get the vaccine. It's just a matter of getting the vaccine, and so, that the same professionals that are at the, COVID sites or at your doctor's office, are also at a pharmacy. They have been trained to do these things. It's not like, some person coming in off the street who's never given a vaccine before. Everybody is certified. Everybody understands how to do the job that they're there to do. So it should not really matter where you go to get it done. It's just a matter of getting it done.
Mm-hmm. Dr. Thompson.
I would just mention and I just remember, for individuals who live in Jersey that might work in New York City, you can go to vaccinefinder.nyc.gov, and it will give you a full list of locations within New York City by borough, and the vaccines that are offered, the Pfizer or Moderna or Johnson & Johnson. And, I remember early on in Staten Island, we were one of the few providers at the time that were getting shipments and doing the vaccinations. And if you recall, it was being rationed out at that point. So we were getting 100 doses at a time. So it was always a mad scramble. And I remember a lot of people from Jersey were able to make appointments in Staten Island because they either work in Staten Island or work in somewhere other borough in New York City, but there was some ease for them to get appointments. So I think that's one of the benefits between the relationship between New York City and New Jersey. You have some of that interchange. What became very interesting for me was we started to get calls from people as far as Pennsylvania who were willing to come to New York City or New Jersey in search of the vaccines. And so that's what I would recommend, the vaccinefinder.nyc.gov if Jersey is not an option for you.
All right, we just placed that into the chat. To be mindful of everyone's time and to thank the panelists, again, on behalf of the Alpha Alpha Lambda chapter of Alpha Phi Alpha Fraternity Incorporated, I'd like to personally thank you, Dr. Thompson, for joining us, and Dr. Flynn for joining us, and Maya Lordo, who had to step off. Thank you very much for the information you provided to everyone. A lot of great questions came our way. A lot of facts were presented in response and in return, and for that, we have to be grateful. Thank you again, everyone, for joining us. This will be available at www.brickcityalphas.com for anyone who'd like to refer back or recommend to their friends and family to watch this session. Everyone have a wonderful evening. Bye-bye now.
brickcityalphas.org, not com.
Thank you very much. www.brickcityalphas.org. Make sure I get that right. Everyone have a great evening. Bye-bye now.
Good evening.